All right, welcome to the first ever edition of A Shot of Diesel. Your questions coming in of all sorts will be answered by me to the best of my ability, or I'll blow a little smoke up your butt as they come in. This is going to be for my entertainment, for your entertainment as well. But I put out a little Snapchat thing in my story about questions, and I got some responses, which is pretty cool. So I have already 3 different categories of questions I'm going to answer. This first edition of A Shot of Diesel will be a little bit of dose of diesel therapeutically. So here we go. Our first question comes from Evan, and he wants to know if there are any low back foam roller exercises that you can use. So I have a foam roller right here. It is a nice tool if you've been working out a lot and you find that you have some tightness in your body and that locally specific, i.e. the tissue in question, needs some work. Definitely something you can use. I use it intermittently. I'd say maybe like once or twice a month maximum, and that's just kind of when I'm at home, cooling down at nighttime, in front of my favorite place, the fireplace, indoors. But Evan, I would say that you can definitely use the foam roller. You could work on hamstrings, quads, glutes, lat muscles. So going to be laying on your side and rolling like that big swath of tissue on your back. Or you can incorporate a couple of breathing exercises, which would be definitely my go-to to solve this low back tension that you might be feeling, or even pain. And one of those things would be to, without a doubt, learn to reposition your pelvis and then add some abdominal tone or activation into that positioning to kind of reinforce it, thereby creating what I would call, or what people in my profession and within my circle would call, some behavior change. In other words, making your body behave a certain way that's different than what it does now. So giving yourself essentially more movement options is going to allow that back to feel a little bit loose. So in sum, what we'll do is we'll put you into a specific position. So what that position would look like for you, we're just starting like easy peasy. I'm going to go ahead and give you a different shot here. Would be to go into a position that would be what we call hook lying. Now, what you might find a lot of times when I have patients that have low back pain or not a lot of tone on the front side of their body is that they'll have a big arch in their back. So when I lift up my t-shirt, you'll see that I have a big arch in my lower back, and I can feel pressure here. If there's constant pressure, if you carry yourself like this all day long, it only stands to reason that things will get tight, quote, or painful from that constant pressure. So the first thing we want to do is just take some of that off. What you'll do is you'll get into this position that I'm in, put your heels onto the ground, and I really want you just to not press firmly, or dig in super hard, but just kind of feel the back of your heels on the floor. And then I want you to imagine taking your back pockets and pulling them to your knees. So that's what that would look like. You'll see that my back will go from a big arch to rolling, much like the squat video. Now, in order to get this rib cage down, I have to turn my abs on. The best way to do that is just to give yourself a big reach, let your chin be relaxed like you're being given CPR, and then breathe in through your nose silently. Now watch my rib cage here, then exhale completely out of your mouth. You'll notice that the rib cage drops and it's hard for me to speak because I don't have much air in it. I'm going to keep that tension. Now, you'll do 5 inhales with tight abs in that position. You'll do that 3 to 5 times, so a total of 15 to 25 breaths in that position. Then I want you to get up and walk around and see how much looser and expanded that backside of your body feels, and how much more secure that abdominal section of your body will feel. You'll feel some hamstring activity. You need to hold that the whole time. You need to hold the ab tension in that nice long reach with your chin back as best as you can. Let me know how that goes. And our next question actually dovetails right into that. This question comes from Grant, and he wants to know about upper back tightness. If you spend a lot of time working on a computer or perhaps driving, this back actually can get closed down. And much like that arch in your lower back, if you are constantly holding yourself in a specific position because of a behavior or because you're forced to, you want to be able to do the opposite, open that up. And we're not going to just open it up, but like the exercise I just showed, we're going to try to put air back there. We're going to try to create expansion from the inside out. So granted, a good exercise for you would use similar principles of getting a nice hip tuck, but you're going to go into a quadruped position, which is essentially an all fours position. You're going to put your hands on the ground underneath your shoulders and your knees approximately underneath your hips. And then you're going to keep your chin in that CPR position. Now you'll notice that I've picked my toes up. That's what you want to do. And then you want to roll your pelvis down. So I feel like my hamstrings are really working here and they're keeping my abs and my back nice and smooth. From here, you're going to stay tall and really push the ground away. And you'll notice when I push the ground away, my shoulder blades come out from behind my body. Same thing here. Exhale. Get really, really tight. Inhale with that tightness. Now, Grant, you two are going to want to take about 5 breaths, inhales, 3 to 5 rounds of that, and really give your body a chance to expand. You're going to feel that each set you do, you're going to be able to get more air in. You're going to feel your ab activity working that much more for you, and that should help your back open up. Now, this last question goes along the same vein. This comes from Chris. If there were some stretches for sciatica and just tightness or some exercises for that. So sciatica is like a nerve root irritation. That's something in your spine. You have nerve roots exiting out of the spinal cord, and then they converge and depart from each other and then reconverge in order to create larger peripheral nerves. The sciatic nerve is a mega one. It's on the back side of your leg. It kind of comes through the back of your pelvis, down the back of your femur, down into the back side of your lower leg. Now, oftentimes, I will preface this, if you have anything like your foot drops and you can't pick your toes up when you're walking, or you can't get up on your toes anymore, or you have loss of any type of bowel or bladder control, or you have any numbness or tingling in your groin area, your saddle area, that's something where you definitely want to go to a doctor for. That's something that physical therapy could potentially help, but not until you are evaluated by a medical professional by way of a doctor of osteopath or a medical doctor. That being said, there are a couple things that I use to treat this in the clinic. The first thing would be to kind of make that nerve root sensitivity or that feeling of nerve pain going down the back of your leg to kind of dampen down. And often what I have found as a first good approach would be to do what's called like a Mackenzie prone extension. So you'll put your hands underneath your shoulders, and then you're just going to arch back. But the key here is you want to think about reaching forward and arching back versus just kind of jamming back a single segment. So you'll see when I reach forward and arch, my butt doesn't really move. But if I push back, you'll see my pelvis lift off of the ground, and then I get a lot of compression here, and you don't want that. You could rip 3 sets of 15 to 25 reps of that, and that should calm some of that sensation down your leg. It may put it back into your lower back, but that's normal. That's what we call centralization. But something that I would do, that's just more of a palliative or treating the symptoms sort of technique. What I then would have you do is use the exercises that you saw in the first 2 questions and utilize those, because what those do is those help that pelvic and rib cage position. They get your hips and shoulders moving appropriately, and when that happens, regions of your body such as your back, your knees, your ankles, elbows and wrists, they have the opportunity to do a fair amount of work and not too much, because if we're missing range of motion in our big ball and socket joints, then we typically have to compensate somewhere else. So what I would do is I would do some of those prone extensions, and then I would start, when you feel like you can tolerate those positions of kind of getting your pelvis underneath you, I would practice that first and foremost. That's what I would do with pretty much everybody in the clinic. One exercise that's a bonus that will work for all 3 of these questions is going to be just to learn how to do a deep squat, okay? The deep squat that I showed in my earlier video, if you take some breaths there, it really creates expansion all throughout the body, helps open up feelings of tightness in the lower back, the upper back. It can really help bring range of motion back to the pelvis through the shoulders. And when you have that, when you have all your movement options, you really have the opportunity to appropriately load and unload tissues throughout their entire ranges of motion and not like one specific area of a body. So what a deep squat again would look like as a review is you would just stand tall, soft knees, I'm heavy on my heels. I'm gonna tuck my hips, I'm not pushing them forward. Rolling them back, same thing, exhale, inhale, and then I just come straight down. And you'll see that I'm really tall, I'm not bent over in my squat, but this is only because I have my pelvis underneath me. It's really hard to stay tall if your butt's behind you, because then you have to really try to extend through your upper back. Reaching long, taking breaths, feeling your abs get tight, staying skinny in the front, and then opening up the backside of your body. I invite all three of you to try all of those exercises should you want to, just to kind of give yourself some relief for those questions. But Evan, Grant, and Chris, I appreciate you throwing some questions and taking a shot of diesel from me, and keep them coming. I like doing this sort of stuff. Thank you.